Hello, and welcome to CAPE for your Patient Navigator Assessment Orientation. The CAPE, or the Center for Advancing Professional Excellence, is a state-of-the-art simulation facility designed to teach and assess skills and behaviors for healthcare professionals. Located on the University of Colorado Anschutz Medical Campus, we train and assess both professional school students as well as those currently working in their profession. For parking, we recommend using the Georgetown Visitor Parking Lot. Exact directions can be found using Google Maps or your preferred GPS software and is located just north of the Education Building 1 and Education Building 2. This is paid parking and we recommend paying for 4 hours of parking time. There are parking kiosks located at the southwest corner of the lot, but you can also pay utilizing the Park Mobile app on your phone. The CAPE is located in Education Building 1, just southwest of the Georgetown Visitor Parking Lot. When entering the building, go to the south elevators and proceed to the 4th floor. The north elevators will not let you out on the 4th floor. Once there, check in at the front desk, where you will be given a clipboard and your personalized schedule. You do not need to worry about bringing anything to the assessment. A clipboard, pen, and paper will be provided for you. There will be 8 different simulations that you will be participating in. Each simulation employs a different patient with a unique condition. Outside of each room will be a door chart giving you a brief description of why the patient is being seen today, the setting of the clinic, and your directions for the encounter. You will be directed by a PA system to let you know when to enter and leave the room. At the very beginning of the assessment, you will be placed just outside your first patient's room. You may begin reading the door chart immediately. After approximately 2 minutes, you will be told to enter the room and begin interacting with your patient. You may bring the door chart in with you for reference. After 10 minutes in the room, an announcement will let you know that you have 5 minutes remaining, and after 14 minutes in the room, an announcement will let you know that you have 1 minute remaining. After 15 minutes in the room, an announcement will tell you to leave the room and move to the next room on your schedule. Please note that you do not need to stay in the room for the full 15 minutes. If you are finished with the encounter early, you may leave the room at any time. However, you may not re-enter the room and continue the encounter once you have left. Once the encounter is over, you will have 2 minutes to move to the next room on your schedule and begin reading the door chart of your new patient. In this simulated environment, you would act exactly as you would with an actual patient. This includes explaining your role, patient's rights and decision-making, identifying patient's needs, and any other duties you would perform as a patient navigator. However, while this is a simulated experience, this is not a time for play acting. Things you cannot do include pretending to leave the room to talk to another professional, provide made-up results, or use made-up props. Here are some examples of what are acceptable and unacceptable actions during the encounter. If you have any questions, please reach out to the CAPE or the Colorado Department of Public Health and Environment prior to arriving.